Hi guys, welcome to Raaonline. So today we are going to have a very short session on exam oriented point of view in general microbiology. So this particular paper is going to come in the first paper and it's going to be a very boring topic. So make sure you are going to have an idea about this particular general microbiology. So whenever we are going to see an first paper in the microbiology, we have the general microbiology, immunology, we have hospital infection control, we have skin and soft tissue infection, which is going to come in the first paper. So it's going to be a very short video. So I will just cover the overall short note on the essay that can be asked in this particular area. So we'll see one by one. So the first one question. So here the first question is going to be the Nobel laureates in microbiology. So here try to remember about certain scientists in the microbiology who have contributed in the field of microbiology, and try to remember their names and their date of era, and try to remember their contribution and what is the particular award they have won. So mostly there's going to be the Nobel Prize that is won by the scientists. So make sure to remember all those scientists' name. So at least 6 to 7 and their associated points will be enough to cover this particular question. And Robert Koch. So again we need to remember about the Koch phenomenon, Koch postulate, molecular Koch postulate, and also the exceptions to Koch postulate. And the microscopy, whenever they are going to ask about microscopy. So these are the 5 microscopy that is very important. The first is going to be the light microscopy, the dark ground, phase contrast, fluorescent, and electron microscopy. So rarely they can ask about the confocal and the polarized microscopy. Again it is going to be the MD point of view. So mostly for MBBS these are the questions that you must know. So in the MBBS level you must know about the light microscope, dark ground microscopy, phase contrast, fluorescent, and electron microscopy. So try to remember the various light pathway and what are the various application and what are the various advantage and disadvantage and the uses. So each have its own clinical use. So try to remember the point. So make sure to have and practice on the diagram the flow of light in this particular cases. And question number 8, we have the bacterial spore. So bacterial spore it's going to come under the particular bacterial morphology, and you should know about what are the various cross-sectional view of spore, and you should know about how the particular spore is going to sporulate and what are the various types of spore like bulging and non-bulging, central, subterminal, and the terminal. So you must know about the position, and you should also know about the spores that is resistant to what chemical, and sporicidal agents the chemical agent which is going to disinfect the spore, and also the demonstration of spore 0.5% to 1% acid fast and other stain which is used for demonstration of spore. And you should know about the bacterial growth curve. It's very important. So bacterial growth curve again is going to be very important. You must know about the various phases and what are the various changes that take place in the phases like lag phase, log phase, stationary phase, and the phase of decline. And the question number 10 is going to be factors affecting the growth of bacteria. So you must know about the various things like oxygen, carbon dioxide, what are the various role of temperature, pH, light, osmotic effect, and mechanical and sonic stress, and moisture and desiccation. So try to remember 2 to 3 points for each of the particular subheading. And question number 11, we have write about the bacterial metabolism. So whenever there is going to be the question asked about the bacterial metabolism, you just define what is a bacterial metabolism first, and how the particular bacteria is able to obtain the carbon, obtain the reducing equivalents, and the energy. So it's very important. So you should try to remember in the point where it's going to the particular organism is going to use the energy to obtain the carbon and reducing equivalents and energy. Okay, so with this we'll go to the staining. Staining again is one of the most important question. So most of the organisms we won't be able to see without staining procedure. We must perform a staining so that we'll be able to visualize the particular organism. So we have what is the staining, we need to define staining and why it is performed and what are the various types of staining. So we have something like simple stain, differential stain. In differential we have the gram stain for differentiating gram positive and gram negative. You have the acid fast staining for differentiating Mycobacterium tuberculosis from non-Mycobacterium organism, and we have the Albert staining for Corynebacterium diphtheriae. And we have the other type of staining negative staining. So negative staining India ink for demonstrating the capsulated organism like strep pneumonia and Cryptococcus neoformans fungus in the CSF. And vital staining. So vital staining is a stain which will not kill the organism, but still we'll be able to visualize the particular structure. So we can study the internal morphology without killing it. So this is the particular staining. You must able to remember this particular staining method. It can be asked in the short note. And again, what is a culture media? So culture media is a particular media which allows the particular organism like bacteria and fungus to grow so that we can study the organism. So types include the simple, enriched, enrichment, selective, transport, differential, and anaerobic. So try to differentiate between all those particular culture medium, try to define it and put an example for each of the following culture media. So yeah, you should also tell about the limitation, like it will not grow something like VBNC, that is viable but not cultivable bacteria, and the virus will not grow in this culture medium. And what are the various other organism that is not cultivable, like in case of fungus we have the Rhinosporidium, Lobomyces and Nemocystis, which will not grow in this particular culture medium. And we have the culture method, so by which we are going to do the method, that's the culture method. We have the streaking, we have the liquid medium culture, we have the lawn culture, we have the pore plate, stroke culture and the stab culture. So these are the various culture methods.